Medical internship plays a crucial role in the healthcare system of Kenya because it serves as the backbone of patient care and also the medical education. As recent graduates, as you realize from many Kenyan doctors or any doctors around the world, you realize that you are transitioning from med school knowledge now into uh, training during internship period, which in Kenya is 1 year and it's mandatory. So during internship, you are going through those various medical specialties being trained under supervision. So this is why you're now going to apply your theoretical knowledge into real life clinical situations. It actually serves as a bridge between the medical education that you have been getting through those 6 years of learning now into real practice. It's where now you are building those core skills of treating patients, because you're being trained now to learn how to work independently in terms of making decisions, but at the same time you're also being trained to work as a team. The healthcare system you don't work alone. You need various cadres to achieve what is needed in treating a patient. So that bridge is important because now you are transiting. You've been a student in med school for all those years and now you have graduated. So after graduating now, we don't want you to touch patients first before going a mandatory critical area of supervision. So that mandatory supervision is important because it allows you to shape yourself as you'll be going to handle patients after you have been registered permanently. You realize after a medical internship, you're going to be registered permanently as a healthcare provider. So during internship, it's actually a hands-on type of patient care. And one thing I can tell you is that they also usually run 24 hours. And to achieve these 24 hours round the clock, 7 days a week and 365 days in a year, is because of these key health workers who are the medical interns, because these are the foot soldiers. It's difficult for most people to notice the difference because these are actually graduates who have all these skills and knowledge and now they are applying them on patients. So these are the people who will be in direct contact with them, while the consultants will come in and they are usually behind the scenes. But most of the things that entails a medical intern is to conduct medical histories. They're the ones who perform physical examinations, they're the ones who order the diagnostic tests, and then they also have to formulate treatment plan. All this in consultation with the consultant, because here you're going to treat patients who come with various medical conditions. Healthcare system, just like any other system around the world, is in continuity. You have to work with the rest of the people, and actually which involves the young group which is now joining the workforce. So you realize as a senior, you want to nurture those who are upcoming. You want to ensure that they get all this knowledge, so understand all this information. So you train them today, and then tomorrow the people are going to take care of you. Currently the medical interns salaries have been slashed by up to 91%, and yet they play a crucial role in the healthcare system in terms of service delivery across the country. And they carry this lot of weight to ensure that they take care of all the sick people that they'll come across, to ensure that they get their treatment as expected. Many of the doctors will tell you from the experience, internship is where now most of the skills and knowledge and all their competency was gained during internship, because there you are practicing under supervision and it's thorough. You have to clock in many hours. Usually you used to do more than 130 hours in a week. That's a lot, so that you get all this necessary skills, all the necessary technicalities of managing a patient, so that when you are permanently registered after the medical internship period is over, which is after 12 months, then you can go out there and practice. So all along, this medical internship is preparing for what is to come, because you bear a lot of responsibility in managing patients.